So for this video, we are going to assume that I've already performed hand hygiene and that I have checked 2 patient identifiers. So my patient here looks alert and is sitting with an erect posture. There's no physical deformities, and there's an appropriate facial expression, and she has articulated speech without difficulty. She's also dressed cleanly, and yeah. Okay, so her skin, I'm going to first start by assessing the skin on her hands because we're going to assess the skin on the rest of her body throughout the exam. So the skin on the hands is of tan, pinkish color, no lacerations or lesions. Now I'm going to assess her head and face. So I'm going to start by palpating the head. Hair is evenly distributed, no thinning or baldness. There's also no tenderness noted. The skull is also normocephalic in shape. Now I'm going to assess the temporomandibular. So I'm going to have the patient open and close her mouth. Okay, perfect. I noted smooth movement with no limitations or tenderness. Now can you clench your teeth for me? Great. And so with this, I can see that the cranial nerve 10 is intact. There's equal distribution of muscle when the teeth are clenched. Now I'm going to assess cranial nerve 12. So can you wrinkle your forehead? Can you raise your eyelids? Squeeze your eyes shut. Smile. Stick your tongue out. And puff your cheeks. Great. Facial nerve is intact. Next is the nose. Nose is symmetrical to the face and it's in the midline and proportional. There's no inflammation of the skin, and no redness or lesions. I'm going to feel for patency now. I'm going to feel outside of the nose, and there's no internal obstructions. Now I'm going to look inside the nose. Okay, great. There's no swelling, bleeding, or discharge coming from the nose, and there's no redness of the nasal turbinates. Next is the eyes. Upon inspection, the eyelashes are evenly distributed along the lid. They curve outward. The upper lid overlaps to the superior part of the iris. And can you close your eyes for me, please? Perfect. And they approximate when closed. The skin around the eyes is intact and without any redness, swelling, discharge, or lesions. Now looking at the sclera, it's a china white color. There's no signs of any jaundice or discoloration. Now I'm going to have you look up. Perfect. All right, after assessing the conjunctiva, there's no discoloration, no redness. The eyeball looks moist and glossy. There's no color change or swelling. The iris is round with even coloration. Now we're going to assess nearsightedness. Perfect. Can you hold that out just 14 inches from you? Perfect. And I want you to cover your left eye and read what it says on the cover.
Physical examination and health assessment.
And now cover your other eye.
Physical examination and health assessment.
Perfect. All right, and the normal result for that is 14 out of 14. Now assessing the extraocular movements. I'm going to start with the corneal light reflex. So I want you to look away, please. Okay. And look the other way. Okay, and the reflection was the same in both eyes. Now I'm going to test the 6 positions of cardinal gaze. So I want you just to keep your head straight, and I want you to follow the pin. All right, those movements are intact as well. Now I'm going to have you just look right here at my ear. All right. And the pupils accommodate to light as they should. Now also I want you to look at a distant object over there. And then look back at this pen. So as she looks away, the pupils constrict, and then when she looks at the closer object, the pupils dilate. And now I'm going to examine the ocular fundus. And I'm going to do that with this pen for the sake of this video. All right. So looking in The eye, the fundus is a creamy yellow-orange color. It's round and the margins are distinct. Now looking in the ears are aligned. They are symmetrical in shape and position. The auricles, upon palpation, there's no tenderness, pain, redness, or swelling. There's no obstructions in the external part of the ear. Now I'm going to do the whisper test to test for cranial nerve 8. So I'm going to get 2 feet behind her, and if you could just cover your right ear. And I'm going to say 3 numbers, and I want you to repeat those to me.
1, 4, 5.
Now cover your left ear.
3, 7, 10.
Great. So cranial nerve 8 is intact. Now I'm going to examine the tympanic membrane. Okay, and I'm going to do this by pulling the external part of the ear up and back. So when viewing the tympanic membrane, it's a pearly gray color. There's no pus, redness, or discharge. Now looking at the mouth and the pharynx, the lips are moist. There's no cracks or lesions. Now I'm going to look at the buccal mucosa. Now, please. Thank you. Perfect. So the inside of her mouth, they're smooth, moist, pink, no lacerations. Her gums are tight, well-defined, pink with no lesions. And then I'm going to have you open your mouth, stick your tongue out. Perfect. The uvula is in the midline of the mouth, and there's no redness. Now I'm going to have you just bite down into your teeth. Great. There's no pain when biting down. Her teeth are white, they're clear of decay, and they're straight. And all teeth are intact. All right, I'm going to have you say, one more time and stick your tongue out. Okay, great. Okay. By doing this, she's showing that her cranial nerve 9, 10, and 12 are all intact as well as her gag reflex. The uvula is mobile, and the soft palate rises to the midline. Now her neck. Upon inspection. Well, I'm going to now inspect the range of motion in your neck. So if you could just try to turn your head to the left and the right. Okay, perfect. She was able to move against my resistance, and I'm going to have you shrug your shoulders against resistance as well. So her cranial nerve 11 is intact. Now I'm going to palpate your trachea. Sorry, my hands are cold. Okay, good. The trachea is located medially in the throat. Now I'm going to palpate your thyroid. So if you could now just look to your left. Good, and to the right. Good, and back in the middle, and swallow. Okay, there's no enlargement of the thyroid fluid. I'm now going to palpate the lymph nodes, starting with the pre-auricular in front of the ears, post-auricular behind the ears, occipital, tonsillar, submandibular, and submental. Okay. None of those lymph nodes were palpable. Now I'm moving on to the anterior thorax, lungs, and heart. So inspecting her chest, the skin is a pinkish tan color, smooth, no lacerations. The chest is expanding with respirations effortlessly. There's no heaving or strenuous breathing. The thorax is symmetrical, and there's no visual pulsations. The transverse diameter also is approximately 1 to 2. Now I'm going to feel for your subclavicular and axillary lymph nodes. Axillary and lymph nodes. Okay, good. Those were not palpable as well. I'm now going to check the apical impulse. So if you could just lay down for me. Okay, so I'm just going to have you turn your head very good. And go one carotid pulse at a time. Okay, and the apical is simultaneous with carotid. I'm now going to auscultate the heart. I'm first going to use the diaphragm of the stethoscope. And I'm moving in the Z formation. Now listening with the bell of the stethoscope, I was able to hear with the diaphragm S1 and S2 sounds. And I'm now listening with the bell for any S3, S4 sounds or any other extra sounds. No extra sounds were noted. There was no thrills, heaves, pulsations in the paracardium. Okay. I'm now going to auscultate the anterior lungs. We're going to use the diaphragm for this. And have to take a deep breath. Bronchial sounds were good. Now moving down to the bronchiovesicular sounds. And vesicular sounds were heard as well. There was no extra or increased lung sounds. Okay, I'm going to have you sit up now, and I'm going to listen to your lungs from the back. Oh, yeah, that works too. On the back, I'm not going to be able to hear the bronchial sounds, but I should be able to hear the bronchovesicular and the vesicular sounds. Take a deep breath with me. I was able to hear those sounds, and I did not hear any wheezing or crackles. Okay, and on her posterior thorax, the skin is consistent with her genetic background. There's no cyanosis, pallor, lesions. Spine's processes are straight and downward sloping. The scapulae are symmetric, and it's approximately 1 to 2 transverse diameter. I'm going to test the respiratory expansion. So, sorry, my hands are cold. All right, so I'm going to have you breathe, take a deep breath. Okay, and both of my thumbs moved at the same time, showing that her diaphragm expands symmetrically. Now, testing for CVA tenderness. Okay, and no tenderness was noted. Now, inspecting the abdomen, I'm going to have you lay down. The abdomen is flat and symmetrical bilaterally. The skin is smooth, pinkish, and aortic pulsation and respiratory movement are visible. The locus is inverted and in the midline of the abdomen. I'm now going to auscultate the 4 quadrants for bowel sounds, starting in the right lower quadrant. And moving clockwise. Okay. Normally we would do this for about 5 minutes, but for the sake of the video, we're doing it a little bit quicker, and I noted that her bowel sounds were normal. Now I'm going to palpate, starting first with light palpitation, and then moving on to a deeper one. Now with the deep palpation, I'm going to have you take a deep breath in. Deep breath in. Okay. the liver, spleen, and kidneys were all not palpable. There was no masses or tenderness. It noted no rigidity and no enlargement of the organs. Now I'm going to percuss all over the abdomen, and I'm going to listen for differences around the organs. Okay. And in the right upper quadrant, I noted that the liver size was about 8 centimeters. Now I'm going to have you sit up. I'm going to inspect for any jugular vein distension on both sides. No protruding veins. I'm going to now look at your papillary refill time. Testing 2 fingers. All right, those are both less than 1 second. Okay, and now I'm going to assess for any clubbing. Looking from the side, and have you put your fingers together. Okay, no clubbing is observed. Okay. Now I'm going to palpate your pulses. So first feeling for the carotid. Okay, this you can lay down for that. Thank you. Okay, feeling one carotid artery at a time. Sides, brachial, radial, other side, brachial, radial, moral, Teal is behind the knee. Those will not be palpable though. Then we have the posterior tibial, which is right behind the ankle, both sides. And then we have the dorsalis pedis, which is on the top of the foot, but that is not palpable as well, and we use a Doppler for that. A rate of 2+ was found for all pulses. Now with the bell of the stethoscope, I'm going to auscultate for any bruits. Carotid, then aortic, renal, iliac, and femoral. No bruits for no leak. Next, the neuro portion. I'm going to have you sit up. And we're going to do a rapid alternating movement test. So I want you to have your hands on top of your legs. You're going to move your hands over and back. Now do that a little quicker, please. Thank you. There, I noted equal turning and quick rhythmic pace. Now we're going to do the finger to nose test. So I'm going to have you close your eyes with your arms out in front of you. And you're going to touch with both index fingers, one at a time, touching your nose. Great. Okay, her movements were accurate and smooth. Okay, next we're going to test your sensory. So I'm using, when you feel this cotton ball on you, I want you to say now, so please close your eyes.
No. 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 No.
Sensory functions are all intact. Now your deep tendon reflexes. We are going to start with the brachial. So I want you to rest your arm on top of mine. Good. Next is brachioradialis. Okay, tricep. I want you to hold your arms both out like this. Good. And you have the patellar. So if you could just do that. Perfect. And all reflexes were noted at a 2+. Now we're going to do the Romberg test. So I'm going to have you stand up. Hands will be at your sides. You're going to close your eyes. All right, you can open your eyes. Normally this would be done for about 20 seconds, but for the sake of this video, we're gonna cut it shorter, and the patient was able to maintain her posture while closing her eyes. Now I'm gonna have you stand over here, and you're gonna walk heel to toe to that side of the room. Okay, perfect. All right, now I'm gonna have you step back over here, and you're gonna swing your leg forward and back. Now leg forward and back. Awesome. Okay, so her gait was even, balanced, and effortless, and the range of motion in her hips was good as well. Lastly, we're gonna do musculoskeletal. So observing your spine and scapulae are straight and even and symmetrical. And okay, we're gonna look also in the skin and tissues over all your joints are pinkish and smooth, and there's no swelling or redness or any deformities. So now your upper extremity range of motion, I'm gonna have you stand up. All right, we're gonna have your arms out in front of you. Now you're gonna bring your arms back, arms behind your back, arms over your head, arms behind your head. Okay, perfect. Range of motion in her shoulders is good. Now we're gonna test the strength in your shoulders. I'm gonna have you shrug. Now I'm gonna try to have you bring your arms out. Now I'm gonna have you try to bring them in and bring them out. Good. So strength in both shoulders is good. All right, now I'm gonna have you sit down. Now let me step your shoulder, elbows. All right, there's no swelling, no bursas. Now I want you to bend and straighten your elbows. Range of motion is good, and now I want you to try to bring them in. Try to bring them out. Good. Okay, rest of the hands out. I want you to bend your wrists like this. Move your fingers up and down. Spread your fingers like this. And move your fingers down to each one. Awesome. Now, resting your forearm on a table. We're going to have your fingers up. Now I want you to bring them in. And now we're going to do the Fallon test to discuss which carpal tunnel. So bring your hands together, try to push them together. Good. All right. No pain or tenderness is noted. Now we're moving on to the lower extremities. I'm going to have you lay down. Okay, so now you are going to raise each leg up while keeping the other leg straight. Great. Now you're going to bend your knee up to your chest. Another knee up to your chest. Okay, now bend your knee and have you bring your leg out. Out. Good. And then I'm going to have you abduct and adduct. Okay, now stand up please. I'm going to have you lift your leg up off the ground. You're going to move your leg in and out. Leg in and out. Good, now sit down please. And try to bring it in. And try to bring it out. Try to bring it in. Ah, you gotta bring it in. Okay, now we're going to test ankle and foot. Range of motion. Can you point your toes up? Good. One toe forward. Good. All right, bring them out. Bring them in. And turn your soles out. And in. Good. Now we're going to do the strength, so try to push out. Try to push out. And try to push out. Strength and range of motion are both intact. All right, the patient was able to move with full range of motion and no limitations. Now we're going to have you stand up. Now if you could just bend over, touch your toes. Good. I'm noting that the spine is straight. There's no curvature noted. And now stand up, please. Twist side to side. And bend to one side. And bend to the other side. So I'm noting that the spine is straight, scapulae are symmetrical, knees and feet are both aligned with the trunk, and the feet are pointing forward. And that concludes my health assessment.